and welcome to a presentation for World Hearing Day. I am your host, Fidel Neptune. Today, Thursday, March 3rd, is being observed as World Hearing Day. World Hearing Day is observed with the aim of raising awareness on how to prevent hearing loss and to promote ear and hearing care. And of course, it is important that as we observe World Hearing Day, we also play our part to sensitize the public on this topic. We have with us today a wonderful panel to speak on different aspects of hearing health. To introduce the panel, we have the hearing technician in the Ministry of Health, Mary Joseph Sidney. We have an ENT specialist, Dr. Leonard Suraj. We have a community pediatrician, Dr. Olgu Ogulusu. Also, we have the principal of the Lady Gordon Opportunity Center, Mrs. Linda Charles Preville. Welcome, everyone. First, I will start off with Mrs. Mary Joseph Sidney, who will discuss hearing health in St. Lucia, and she'll also get the opportunity to speak on the services that are available and also how can persons go ahead and access those services.
Good morning again, all listeners and viewers. We would like to thank the government of St. Lucia, Ministry of Health and Wellness, and the Family and Elderly Affairs, and also the Government Information Service, our partners and stakeholders, for this wonderful opportunity to inform persons about the ear and hearing health care in St. Lucia. The Ministry of Health, Wellness and Elder Affairs, through Community Nursing Service, has joined with the World Health Organization to commemorate World Hearing Day today, March 3rd, 2022. This is the largest global awareness campaign on ear and hearing health, which calls for actions to address hearing loss. WHO, or World Health Organization, estimates that approximately 466 million people around the world live with some sort of disability in hearing loss. The prevalence of this hearing loss is expected to rise due to the changes in the population. That's where the young persons are now using ear devices to listen to music, play games at loud volumes, also work and recreational noises, as well as persistent untreated ear conditions. World Health Day aims to promote public health actions for ear and hearing health, also to stimulate intersectoral partnership for ear and hearing health, raise awareness on hearing loss at both national and community levels across the world, encourage behavior change towards healthy ear and hearing care practices. Many causes that lead to hearing loss can be prevented through public health measures. Hearing health care is necessary to enable persons to establish good health and well-being within the provision of quality education, as stated in the Sustainable Development Goals 3 and 4. The Ministry of Health and Wellness and Elder Affairs have established hearing health care clinics in the north at Entrepot Wellness Center since 1986, which conducts hearing clinics on Tuesdays and Thursdays every week, and another in the south at the Viewfort Wellness Center since 1991, where hearing clinics are held on a Mondays and Wednesday every week. These clinics are managed by the family nurse practitioners, the two, a hearing technician and a registered nurse. Since 2017, all hearing services within the Ministry of Health, Wellness and Elder Affairs are free to the public. Clients can be referred by the private or public physicians, employers, or self-referred, and the hearing can be assessed by appointments at those facilities. Since 2018, the number of persons seen at these clinics have increased due to the persons who were identified and fitted with hearing aids from the Starkey Hearing Foundation. Since the pandemic, despite the many restrictions, the number of persons accessing hearing health care continues to rise, possibly due to the public health measure of wearing of masks, which may have created a big barrier to those persons who have hearing loss and are using lip reading. The Ministry of Health and Wellness and Elder Affairs have collaborated with a number of stakeholders, both internationally and locally, in the provision of ear and hearing healthcare in St. Lucia. What beautiful day to be able to express our sincere gratitude to all. Hearing healthcare was established in the mid-1980s through the assistance of the Canadian International Hearing Services, headed by Mr. Gordon Kerr. The Canadian Hearing International Services contributed to training the first hearing technician and also donated the first audio booth, or the hearing test chamber. And they also supplied St. Lucia with many of the necessary equipment and supplies needed to manage persons with ear and hearing issues. Recently, 2017 to 2019, St. Lucians benefited from the Starkey Hearing Aid Foundation, founded by Mr. William Austin, who again conducted free hearing, ear, and healthcare missions to train persons, healthcare workers, EMTs, and NGOs in screening for hearing loss, hearing aid fitting and maintenance, and also aftercare services. Over 1,000 persons identified with hearing loss were fitted with hearing aids and were also given the hearing aid batteries free of cost. We also have collaborated with PAHO and WHO, and who today have provided the information and materials needed in, to be able to assist and to be partner with other world organizations to recognize the World Hearing Day today. Locally, St. Lucia Electricity Services Company made a generous, timely, and appropriate donation of a new audio booth, the hearing test booth, which serves persons in the north at the Entrepot Wellness Center. The Child Guidance and Development Center, headed by Dr. Kim Gardner, also have assisted in training healthcare workers in screening for children with hearing loss, also to assist in early identification of hearing loss, and also in language and speech therapy. The CDGC also provides necessary therapies and treatment rehabilitation services for children who are identified with delays, speech and language delays. We also, within the Ministry of Health, have a community pediatrician who will speak to you a little later about her duties. Also, we have collaborated with Ministry of Education, the Special Education Unit, who also refer children identified with speech and language issues for hearing and screening tests. We also have our ear, nose, and throat specialist, in the person of Dr. Suraj, who's going to speak later, and Dr. Sixtus Gabriel, who also we refer the clients to identified with hearing loss, and also they assist with training. We also have the Lady Gordon Opportunity Center, headed by Mrs. Preville, and she will talk about the services offered there as well. We also want to thank those other trained hearing technicians, volunteers, the NGOs who have assisted in conducting hearing screening and assisted with the Starkey missions in St. Lucia, and also with aftercare for persons who have been fitted with hearing aids. We also want to thank the media personnel, Ms. Neptune and the team, and also the other hearing health team. The services that we offer within the Ministry of Health, Wellness and Elder Affairs are screening, hearing screening for all ages. From birth to 5 years, hearing tests are part of the screening at all the child health clinics. We have screening at 6 weeks, 8 months, 3 years, and 5 years. And any child who has been found to have been identified with hearing loss are referred for further testing. Currently, we have available the autoacoustic emission test being done by one of our ENTs, the nose and throat specialist. We, in St. Lucia again, we conduct some awareness and sensitization campaigns at health fairs and outreach services, where we educate persons on ear and hearing care. Recently, on the 27th of February, we also participated in Men's Health Fair, where men were screened, flyers were given, education about hearing health, and tips on to make listening safe by WHO. We also conduct audiograms or hearing tests for all persons at the various hearing clinics. We also assist in fitting of hearing aids, troubleshooting, educating individuals on the use and care of hearing aids. We also conduct counseling, irrigations. We take impressions of hearing of persons identified with loss for the hearing aids. We also do employee hearing evaluations, and we also assess workers in noisy areas. Recently, we have been screening persons who work on the cruise ships. We also conduct school hearing screening at the various schools. And again, to commemorate the World Health Hearing Day, we did have 2 sessions with the teachers and the students in a school in the South, where again we spoke about hearing loss, the causes, the effects of noise, and to both groups, and encourage them to practice safe listening. And we also assess and treat minor ear conditions. World Health Organization recommends that early identification is crucial to the care and rehabilitation of persons with hearing loss. When someone has a loss, they are unable to hear at normal levels, which would be between -10 to 25 decibels of sound. Someone with even mild hearing loss may find it difficult to hear in noisy places. With moderate loss, a person may have difficulty understanding regular conversations, and in severe loss, they may even they would be unable to hear even loud sounds. There are several causes of hearing loss. They range from maternal infections, when mothers are pregnant, if they contract some of the diseases during pregnancy. Also, premature births, where the children lack some oxygen at birth. And in the newborns, again, we see babies born with jaundice. With children and adults, we also can we can see a hearing loss from infections such as measles, mumps, or recurrent ear infections, trauma to the head, wax or foreign objects in the air, loud music, listening at unsafe levels with headphones and other ear gadgets. And in older adults, we can see due to medical conditions, for example, hypertension, diabetes, medicines, and even the normal aging process. And also if persons have been exposed to loud sounds. The impacts of hearing loss, if not addressed, can affect many aspects of one's life, like listening and communication, speech and language development, the ability for a person to acquire knowledge, education, also employment and financial well-being, social isolation and loneliness, mental health, interpersonal relations with families, co-workers, also their identity and stigma, and productivity at work or even social areas. The prevention of hearing loss is key to maintaining good hearing health. Some of the tips to prevent hearing loss: we would advise that you do not insert any object into your ears. Avoid swimming in dirty or contaminated waters. Do not hit or slap anyone on the ear. We recommend that you use earplugs, earmuffs in noisy areas and use them appropriately when listening to music. Check if any medicines that you take may affect your hearing. Teach people or teach your child, for adults and families, to listen safely through personal audio devices. Keep the level of volume down when listening to music. Limit the time spent in noisy activities. Use smartphone apps to measure the hearing levels, your sound levels, and to see the doctor if any abnormalities are detected in the ear, any discharge, any pain, and to have your hearing checked at least annually, every year, for persons in the noise, and for other persons who have never had it, to just have the hearing checked every year. To have your hearing checked, you can access the hearing services at two of the facilities. In the north, it's at the Entrepot Wellness Center on a Tuesday and a Thursday. You can call 468-7935 or 468-7936 from Mondays to Fridays between the hours of 8 and 4:30 p.m. In the south, at the Viewport Wellness Center, on Mondays and Wednesdays, at telephone number 468-7985 or 468-7986. Remember, anyone and everyone can have a hearing test. We appeal to all persons who listen to loud music or use headphones or other ear devices, who work in noisy areas, owners of entertainment venues and their patrons, persons who operate heavy machinery, musicians, persons who have had previous head injury, persons with repeated ear infections, or persons on treatment for cancer and other diseases. The DJs and journalists persons who also play musical instruments, swimmers, we appeal to you to have your hearing checked at least every year. And if you haven't, you can make an appointment to receive the treatment, the hearing test. This year, WHO will mark the launching of the global standard for safe listening entertainment venues. And we will be hosting a webinar sometime. So all persons, especially those that we have mentioned, please try to attend. Thank you very much.
Thank you very much, Ms. Sydney. Of course, providing us information on the causes of hearing loss and also the services that are available and where persons can get the hearing test done. One of the things that contribute to hearing loss has to do with the industrial aspect. And with that, we now turn to Dr. Leonard Suraj, who will speak on industrial hearing healthcare and also making relevance to the policymakers and also the plant workers and also the plant managers.
Thank you very much, Madam Chair, Madam Moderator. I must, before I start off, I must compliment Nurse Shallery for Sydney for a very comprehensive presentation. It left me, apart from industrial audiology, with very little to see. But however, I will stick to my topic. But before I do so, I would just like to give a broad overview on hearing evaluation. For example, noise. Noise is unwanted sound. So my noise maybe not be your noise, and my music may be a noise to you. So noise is an irritating sound. Okay? And overexposure to noise can lead to damage to the air. And the damage to the air can be either temporary or permanent. Temporary, if you have blast injuries or anything that's a very high energy sound, can, even though it lasts for a short time, but it can actually cause damage to the air. So, according to the standards established for that, and OSHA, which is the Occupational Safety and Health Administration of the United States, they basically are our standard bearers. And their finding or their policy is that if you are exposed to sound in excess of 85 decibels for 8 continuous hours, that's dangerous. So you may ask me then, well, how much is 85 decibels? As I speak to you there, I'm speaking at about 60, 70 decibels. If I was whispering to the Sydney, it would be like 20 decibels. But talking in ordinary conversation is about 60 decibels. So you can extrapolate and know what 85 decibels is. And 85 decibels continuously for 8 hours becomes dangerous. So decibels are a measure of loudness. There are other aspects that we also measure, and that we take into consideration, and that is the pitch. Because when you look at sound, you look at loudness and pitch, and the pitch is measured in terms of cycles per second, hertz. And 1,000 hertz is called a kilohertz. So basically, when we measure a hearing test, we are measuring how loud we have to put that sound for you to begin to hear it, which is your threshold. We are also measuring what frequencies that you are most sensitive to. Because from a factory perspective or anything else, you look at the hearing test, the hearing loss, and at what frequency you're dropping it. Hearing impairment can be mild, moderate, or severe. Basically 3 categories, and profound. this classification is important. I'm not going to go into details of how many decibels for each. I don't want to get too detailed in that. However, the decibels are important because it determines how you program your hearing aid. Because current hearing aids are programmable hearing aid. It doesn't come like before, like an amplifier. It selects your frequency based on your hearing test to be able to deliver the appropriate loudness you need at each frequency. That's a modern, since 2009, that's a hearing aid that's been done. So older hearing aids would have been more the analog types, etc. So pitch and frequency, and for people who are aging, the frequency drop at a higher frequency level, so you can determine that. Other things that can affect your hearing is medically, is eustachian tube dysfunction, whereby you're not hearing properly and there are other issues, but a hearing test can actually determine that. I would also, before I get into the real industrial aspect of things, I wanted to give a little more background on noise, etc. As I said before, when the air is exposed to noise, it causes damage. And the damage translates itself into the amount of energy that hits the cells in the inner ear that causes a metabolic problem and causes hearing loss. So if you pass by a boombox or one of these in parties, etc., when they have the big speakers on the outside, say you're passing one and all of a sudden some wire got disconnected and you heard this blast sound. By that time you're almost completely deaf in that ear, or maybe both. But gradually it gets better. So initially you have a hearing loss that may be temporary. And since the threshold is temporal, we call that temporary threshold shift, TSH. And it means that you're exposed to loud noise, the air is a little obtunded, but there's a chance it might recover. So you have at least a 3 months grace period to determine whether the nerve is irreversibly damaged. And when it is irreversibly damaged, you have nerve deafness, and that is irreversible. It cannot change. It's for life. So based on this, you can understand how in industries it's very important to be able to monitor the exposure there. Okay? Causes of hearing loss, before I get into the industry itself, is usually it is continuous low volume in excess of 85 decibels over a long period of time. I have had personal experience of patients I see with ringing in the air, we call tinnitus, females who are not exposed to loud noise. They don't use weed whackers, they don't use power saws or anything, but they have hearing, and when you do the test, they have hearing loss at a certain frequency. Only if on further questioning, only to find out they used to use a sewing machine. Especially the electric sewing machine that has a more tapping noise, tap, 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 tap noise. And if you check the frequency of that noise and look at the frequency with which they are dropping for their hearing loss, identical. So this is where your forensic audiology comes in, where you can now determine, after the event has happened, that the hearing loss this person have can be attributed to an incident that happened 10, 15 years ago. So that's just a little brief thing on injuries and hearing loss. Now, with industrial hearing loss, most companies, especially factories, would have some noise generating component to it. Not all the factory and not all the stations or the departments. So a company that cares for its staff would ask me, I'm just giving you the rundown, will ask me, well, doc, I have a factory that I operate and I want to protect the hearing care of my staff. So I want you to come and assess it for me. So I would schedule a day where I would go in there where they have normal activity, not a day when they have holiday and everything is quiet, machine not working, when they have everything. And I would speak to the managers and tell them what I intend to do. I intend to go to each of the stations and do a hearing evaluation on when they are at work and measure the hearing level to which they are exposed. And afterwards, I would interview most of the staff and find out how long they spend in each station. Some of them actually don't stay in one station. For example, somebody filling a bottle and somebody who's putting a label on it may shift from one to the next. And each of them, and even the bottles, when they touch each other, makes a sound, a certain frequency. So having done that, I would measure, I would check all the different stations and put a little sticker of the hearing, the level of noise that exists there. And afterwards, I would speak to the managers and tell them, develop a report and tell them, well, in your office I found A, B, C, D, E. And the exposure of the noise, I think that if it is in excess of 85 decibels for more than 8 hours a day, we recommend that they do hearing protection. Now there are different types of hearing protection. There's a depending on the amount of noise you want to block. And the rating of the different hearing protection devices are called the NR rating, the noise reduction rating. So you'll see a noise reduction rating of 25, 30, 40 decibels. So if somebody in a station is clocking 90 decibels, all I need is about a 20 decibel noise reduction, and they're into 70, so they're safe. So having done that, the second thing I would do is to do a hearing test on each of the patients that were the workers and find out to what extent the hearing is, how long they've been working in that area, the hearing test, etc., and then produce a report, an individual report for each person based on what I find in the hearing test, etc., and have a recommendation section where I recommend to the manager how to deal with the hearing loss, how to take care of it. There are certain formulas that we use, but generally, if somebody is not exposed at all, you're a secretary, you're nice and well protected, then we don't really have to do annual hearing test, but we will do it once. If you're exposed to 85 decibels or more, we will do the hearing test and based on the recommendation determine that you need hearing protection or you need to get an annual hearing test. Everybody, apart from those who are normal and unexposed, will need an annual hearing test. The basis of on which will determine what we do afterwards. Now, the thing about hearing loss, etc., is that it doesn't happen immediately. So you might be exposed for 20 years in a noisy environment, but it does not begin to, you do not begin to get hearing loss until much later. So you exposed from 40 to 60, meaning by the time you have 40 years or 60 years, that 20 years you're exposed to it, or maybe 15. But you go home, you're retired, etc. After retirement, you begin to get hearing loss. And but you can safely say, well, I have left the work, so that's not the reason I have hearing loss. And so the test, the audiology test will say, yes, the frequency you're losing and the frequency you're exposed to tell me that that exposure 15 years ago is causing you a problem now. And so you can understand how the worker has to be protected from that perspective. And there are some good managers who would invite us to come in and look at the setting, assist them in developing a plan, and we do have that plan where we can discuss with them what we call a herring conservation program. And the program basically looks at your measurement of your noise exposure, the engineering and administrating intervention you can put. For example, there is a noisy area. You cannot say, well, there is noise, I can't do nothing about it. You find out how can they barricade that noise? How can they put another muffler on that machine to soften the noise? Or how can they open up a window to allow more ventilation and dissipation of the noise? How can they use lead or whatever is necessary to cause walls that can protect? So all these are called engineering intervention. Thirdly, if you have excessive noise that is not amenable to engineering intervention, then you may have to get protection. And as I said, there is the muff, there is the plug, there are different things which have different ratings. And you have to follow this with audiological hearing testing, etc., and see if the hearing is actually deteriorating. And then you can advise the company what to do about the deteriorating hearing, whether to relocate them, whether to strengthen certain things. Also, education. Compliance goes hand in hand with education. So we provide an educational service where I come and give a lecture to the workers, expressing to them the problem that arises from, because hearing loss is not painful. It's almost like a silent disability. And this is what WHO head has called it, the silent disability, because there is no pain and you gradually, and when your hearing loss is so gradual, as far as you are concerned, you are fine. It's somebody else who's not speaking clearly. And so they tell you, well, speak clearly, I'm not hearing you. Why don't you all speak clearly? But it is them who have the problem. And so you have to pay attention to all these. So the education whereby we appraise the workers of the severity and the consequences of hearing loss, because implementing the hearing testing, the hearing conservation method is a problem, because you go in the factory and see them having the muff around their neck. You see them, especially on the tarmac on the airports. They find it's too hot. There's lots of excuses, but legally, they are supposed to. The enforcement has to happen. The manager can be held liable if he did not enforce it, because you can lose your job if you fail to comply. And on the legal side, also, it's important that the managers understand that they have to ensure that adequate preparation is made, adequate provision is made to ensure the safety of hearing in their workers. Okay, and it is not to say, well, he didn't want to use the hearing thing, so that's his business. No, it's not your business to ensure that they use it adequately, because legally you can be held liable for the deterioration of the health care if you have not shown adequate measures to counteract the adverse noise levels. So this service exists where we can go over all these things. And I believe the way forward is that we should have a hearing compliance certificate prominently displayed in the workplace, so that the workers will feel confident that whatever needs to happen can happen, and the managers care for them, because the strongest asset you can get in your company is your workers. On that note, I would say that this facility exists, and we are hoping that policies can be set up to take hearing loss seriously and hearing evaluation. I'm even more passionate on the issue of early childhood development and speech-language development in children. You'd never believe the amount of damage you can cause when a child doesn't hear properly in the early stages in their life. But this is not in my domain at this point, so I will not touch that one. Thank you.
Thank you very much, Dr. Suraj. Of course, it was very important that you mentioned the different ways in which plant workers can be affected, and it's something that happens over time. So, of course, someone might be working and they might not see the damage that is being done, but actually it is being done. So I guess persons will also see the importance of ensuring that the managers put things in place to ensure the protection of their air as well. Thank you.
Okay.
Another area which is very important is children. That's one of the groups which are very important, and it is important because you find that sometimes that will affect a child in the long term. And of course, we have with us Dr. Ogulusu. We will talk, and she will talk about the early identification of hearing loss in children.
Thank you, moderator, and good morning, viewers. Okay, so I'm going to lay emphasis on children and early identification and then prevention of hearing loss in children. Like we have heard, you know, the theme of today's World Health Day is to hear for life. We need to listen with care. And the goal of WHO, the medical team, the health team, and every one of us is that we should come to a place that no individual should experience hearing loss that is due to a preventable cause. And those who already have it, that they should achieve their full potential by having the treatment that is required, rehabilitation, and education. So if we want to achieve this goal, we need to identify who are those children who have hearing loss. And as we have heard, you know, hearing, the sense of hearing is very, very important in life, because it is by it a child will discover his world. It is by it the child will be able to express himself and able to learn. And like we have said to children, if a child is born and is not hearing, it's going to affect the development of his speech and language. And unfortunately, a child is born not speaking. So if we don't pick it early, we'll just think, oh, this child is there, is not speaking, but the damage is being done as early. So we need to identify them early. Such a child will not interact socially with the world. So it affects their psychosocial well-being. Like we have had, it determines the level of education such a child can attain, especially if it's not detected and treated. You know, it determines the quality of life that individual, that child will live later in life. We've heard the previous speaker has talked about isolation, you know, affecting their education. So it is very, very important in children. And so one of the things that is important that we do in children is to detect them, monitor every child. And like we've heard, it starts from the time where they are born. In some places, we even do what we call newborn screening, hearing screening, within the first month of life. And in some places, before a baby is discharged home, this is done. In our setting, we start our monitoring right from 6 weeks. And I want to use this opportunity to stress it to every parent, every mother, that the normal child health routine clinic that we do, it's very important, because that is where we do all of this screening, not just hearing, but the total development of a child. Then when you come at 6 weeks, we check what we call the milestones, what we expect the child to be able to do. And in relation to hearing, I'll mention some of these so that I can alert mothers to look out for these. And when they see it, and sometimes the mother may even overlook it, and that is why coming for regular, normal cleaning checkup is very important. So a baby between age 0 and 4 months, we expect that baby to startle with loud noise. So those are some of the questions we will ask you during the normal checkup. We expect the baby to wake up with noise, and we expect the baby to respond when to a familiar voice. When the mother is talking, like you have a baby, somebody is carrying, and you just come in at the door and you start talking, we expect the baby to, to respond in a way to know, oh, I know that voice. Or a baby who is crying and the mother is just talking from few meters away, maybe in the kitchen, and say, oh, my baby, I'm coming. The baby calms down because okay, though I can't see her, but mommy is close by, someone I know. So those are some of the things we monitor. And then after that, after 4 months, between 4 to 9 months, we expect babies to smile when you talk to them, and they turn to toys that makes noise. You wriggle, use a toy to make noise behind them. We expect the baby to turn to that. And even the baby itself starts using his or her own voice to get your attention. Just make some coos, make some noises, just to tell mommy, where are you? So we know, okay, that baby is hearing the noise, the sound, and is learning that I can use that to call my mommy. And then by 1 year, we expect the baby to start talking, saying dada, mama. So when we see a child at that age and the baby is quiet, not saying much, then we want to know, is this baby hearing? We want to do that. And we could have detected that much earlier. For older children, toddlers and older children, some of the things that is very, very important is when we start seeing a child, we say, oh, this child is not listening, has attention issues, or this child is hyperactive, had what we call the attention deficit hyperactive disorder. One of the screening we give such a child is hearing assessment, because the problem may not have started while they are newborn or early in life, but develop as the child is growing. Or a child that is not learning well in school. It's not just, oh, he doesn't have the brain, he's not intellectual. It could be the hearing that is the problem. So assessing children with learning disability, hearing assessment is very important. And I also want to tell all my viewers this morning is that when you start noticing a child you talk to does not respond immediately, don't just say the child is ignoring me, the child is rude. When you talk to him, he doesn't answer. No, it could be that he's not hearing you. Yeah, so we need to do, or you see a child that always turn up the volume of the TV so that he can hear, or always sit close to the TV. It could be both hearing and vision that makes the child to do that. So those are the things we monitor, when the children come for the regular checkup. And so when we see all this, we need to prevent some of the causes. So I'll just mention again some of those causes in children that can lead to hearing loss. Now, 1 in 2 of a child with hearing loss, the cause will be genetic. That means something that we may not be able to prevent. Problems with their genes in the formation. So they come, the baby are born with that hearing loss. And that is why it is important to detect them early within the first few weeks of life. And like we have heard, there are some infections that mother could be exposed to in pregnancy that could lead to hearing loss in the baby. And so it means that baby mothers should receive good care. Some of these infections, thank God, they can be prevented. Especially some of those infections we call toxoplasmosis, rubella, cytomegalovirus infection. And some of them we have immunization, vaccines to prevent them. And then also in some babies, it could result as a complication of birth injury. Like we heard earlier, if you have the severe head injury, which could occur in difficult deliveries, or a baby is born very premature and has to receive intensive neonatal care, and baby with severe jaundice, and later in life or early in life they have some severe infections like meningitis, it could lead to hearing loss. And I must not forget to mention infections like measles, like mumps, like whooping cough. This one, we don't see them again, so we don't see, because of vaccination. But when they occur, those are their complications. They can lead to hearing loss, among others. And then in older children, when a child is having recurrent ear infection, then that is not properly treated, and then can lead to damage the eardrum. The eardrum can perforate. That can happen. And we've heard about loud noise. So it's very, very important. It can affect children too. So these are some of the causes. And then also there are some medications I would take that can lead to that. But thank God, most healthcare providers know about this, especially when those medications are given in high doses. And so we try to avoid them. So how do we prevent? How do we prevent? Now we need to detect them early. And there are some things that we can do, both the healthcare provider and the populace, to prevent this. So I'll start with having a healthy pregnancy, which is very, very important. So I'm encouraging everyone, let's avail ourselves all the antenatal care that we have. And when a pregnant woman has an issue, don't take it lightly. To you, it may be something that is mild, but it could affect the baby. Like if a pregnant woman picks rubella in pregnancy, to her she will just have a mild rash, mild illness, may resolve within 2 days, may not even know, but the baby will be affected. And so we need to do that. Have a healthy pregnancy. And then also ensure that the children have their milestone monitored at the routine child health clinics. And I'm going to stress immunization here. I mentioned rubella. Thank God most women in childbearing age now are immune against rubella. Why? Because we give that rubella to them as children. So we give measles vaccines, we give mumps vaccine, we give rubella vaccine. And even the rubella, we give a booster dose, especially to children. So I'm using this opportunity to tell viewers that when we talk about vaccination in children, not just protecting them from those infections, but protecting complications and protecting their own children later in life. Even the meningitis that I mentioned, one of the organisms that causes meningitis, we protect them from childhood. Yeah, Haemophilus. And we don't see it often again because of this routine vaccination. And I must say, some mothers now, they're saying, why should I give my child a vaccine? I don't see all of that, because we have been doing it over the years and we don't see them again. Now we want to let our guards down. So I don't want us to be like that, where if we let down our guards and we reduce the level of immunization, then those diseases will start to come and we'll begin to see those complications. So we need to do that. What other things we do? Apart from those early intervention monitoring, we continue the monitoring as a child grows. Even at preschool level, at school entry, we continue to monitor them. And where they are found, they are detected, They could be referred, the nurses at the centers could refer them to their pediatrician, to meet the community pediatrician. We even get referrals from schools. So even right in school, and thank God we have one of the principal of school with us. She's going to talk more. They identify them too and then refer them to the wellness centers where they can be assessed by the medical profession and then refer them to specialists. If we can identify the cause, if something that can be treated, if not, then help them to get proper aids that is needed and rehabilitate them and make sure that their education is taken care of. Another unit where work hand in hand with us is the Child Developmental Guidance Center, which we have mentioned. We refer children with not just hearing but total developmental delay to them, and they assess all of these. And once it is determined, then they start to give some speech therapy and all the other forms of therapy that they need. So this morning I am just alerting the viewers on the importance of detecting this in little babies, in children, and that is by doing what you need to do, and the medical team also doing what they need to do. So we need to work together, and then we can pick these children early. And it continues in school. Because we have teams in the school, teacher trained for this, to detect these special needs in children, and they are referred appropriately. So let's avail ourselves of all of these opportunities and use it so that we can achieve our goal, that no child, no individual will have hearing loss due to something that we can prevent. The ones we can't prevent, we'll leave it. And those that we can't prevent, then we detect them early and give them the necessary rehabilitation, treatment, and education that they need. Thank you.
Thank you very much, Dr. Ogulusi. Of course, it was important that you reiterated the importance of parents playing their part also in preventing hearing loss by ensuring that they monitor the children from a very early stage. And also you mentioned the fact that it starts from pregnancy and ensuring that they have a very healthy pregnancy as well. Thank you very much. Of course, we know that Dr. Ogulusi spoke about in terms of parents playing their part and monitoring, but we also have the situation where you find that a child may be identified at a school, and we have the Lady Gordon Development Center here with us and the principal, and she'll be able to speak as to what happens at the school and what services do they actually provide.
Hi, good morning all. I'm happy to be here. It's an important day for us, especially those of us who work with children with hearing loss and so on, and also like Nurse Sydney and Dr. Suraj and Dr. Ogulusi stress that when we lose our hearing, sometimes it's gone for good. Principal of Lady Gordon Opportunity Center. We didn't start off as Lady Gordon Opportunity Center. We are formerly the School for the Hearing Impaired, and we still call ourselves and identify ourselves as the School for the Hearing Impaired. Why? 1973 was a very important year for St. Lucia. That is the establishment of the School for the Deaf then. And I heard Nurse Sydney mention Gordon Cole. He was also a friend of the deaf in St. Lucia. Through him, many of us got our first training working with children with hearing impairments. And I also want to mention, Dr. Ogulusi said about the immunization, which is so important. Because of the level of immunization and health care in St. Lucia, we do not have that great number of children with hearing impairments coming to the school anymore. In 1982, we had our largest group of students entering the School for the Hearing Impaired. And many of them, it was because of their parents, their mothers actually, with rubella or contracting meningitis. So we have to applaud our Ministry of Health and the work that the nurses did and the doctors did then to ensure the education of parents in getting their children immunized. In 2003, we changed our name to the Lady Gordon Opportunity Center. We were once, many years, housed at Sanssouci, and we moved to Cicero through the efforts of the Society for the Deaf, and we moved with maybe 45 students, all of them hearing impaired. What has happened through the years? Like I said, immunization was a boost, so we started having less and less children at the school. So in 2003, we opened our doors to children with educational needs, but always remembering that this is the school for the deaf. Right now, presently, we now have 10 students with varying degrees of hearing impairment. We have 4 of our teacher aides who are all hearing impaired, who came through that 1982 group of students, so they are now working with us. One of the things that we strive is to speak to our parents that it is important that you follow the 3 years, the 5 years assessment. Lady Gordon gets its students from three identities or 3 groups. MDT, which is the multidisciplinary team, which is from the Ministry of Education, Special Education Unit. This unit works with children who are already in mainstream schools. Assessment is done. Identification is done maybe through the teachers at the mainstream school or the parents themselves. So when assessment is done, we have a sit down, we discuss as a team, because there is a team, and the determination is made, where did this child go? Then CDGC, Child Development Guidance Center, which works with children from 0 to 8, and they too, if they have children marked for Lady Gordon, those children come into the school. And of course, those children who are hearing impaired. This is the only group of children who don't go through any assessment. So they come through the school because this is their school. One of the things that we have found though is that we receive some of our children very late. And it's because sometimes denial from the parents, and it's because they didn't follow through with their health checks when they should. Because sometimes when they come, when we look at the health card, we see you are missing the 5-year assessment. Our children who are hearing impaired are among other children who have various disabilities as well, intellectual challenges, physical challenges, autism spectrum, and so on. One of the things that we do, especially for our children with hearing impairment, they belong to us, so we have to work with them and meet them where they are. So sign language is a part of our program at the school. We teach our students, including those with other special needs, in one classroom. So our children who are hearing impaired, they learn their sign language, which is primarily their mode of communication. One of the areas and the most challenging part for us is that our parents and the families do not adhere to that. And one of the things, and I heard one of Dr. Ogulusi mention it, that parents have to be part and parcel of whatever program that's going on with the children, because they feel isolated. And if they do not have that form of communication, they will be even further isolated. So our greatest challenge is always our parents. Though we encourage them to come and learn the sign language, we open the doors for them. We say to them, you cannot be doing just home signs. There are structured signs that our children will be able to go out into the field of work and become part of the wider society. So that's one of our biggest challenges at the school. We also have the program that we do where we had our parent support program for our children. That again is not supported fully by the parents. One of our challenges that we have faced with our children, I'm speaking specifically for our deaf children now, not the opportunity for them to go into a secondary school. Many years ago, I sat with one of our chief education officers then, and I said, our children are capable, academically they can, but we need the support at the secondary school. It is costly, having an interpreter through the school. It is costly, quite aware of that, but it was never done. So we teach our children up to the age of sometimes 18 or 19, so they remain there. One of the good things that had happened, care opens its doors to us. So a couple of years ago, we had 4 of our hearing impaired children go into care, and a teacher accompanied them through the 2 years, and they were able to get work, they were able to become independent. So at Lady Gordon, we say to you, the parents, all the time, because parents walk to the school and they said, my child is not performing. What do? I would like to enroll my child at your school. I say, no, this is not the process. There is a process, and the process is important. So the process is you go back to your child's school and you say to the teacher, I recognize that my child is not meeting the standards. What do? The teacher then will say to you, yes, I recognize that, so this is what's going to happen. We are going to go through the Ministry of Education Special Education Unit. Special Education Unit will say to you, you now need to follow Dr. Ogulusi's clinic. You need to take your child there. At the clinic, you need to have your health checked in terms of your eyes, in terms of hearing, in terms of even a physical checkup, and so on. After this is done, then follows an educational assessment, and that is done by the Special Education Unit and the team of assessors there. And that also goes for CDGC, who have the battery of persons doing the assessment. We also work with children with speech and language delay. And quite a few of the children coming through CDGC are children with speech and language delay. So we work with the children at the school. Unfortunately, we do not have a technician at the school anymore. We used to have one. He now works with Starkey Foundation. So at the school, we do have children who wear hearing aids. We do have children who need their hearing checked periodically. And we do have children who would need their hearing aids fixed, mended, changed, and so on. So we contact sometimes the Entrepreneur Health Center that we still send persons to, or we ask the gentleman to come in to do the checks as well. So working together, Ministry of Health, Education is the best way forward. And one of the things I would say to parents out there are opportunities for your child. Hence the name Lady Gordon Opportunity Center. It's giving your child or the children of the nation another opportunity. Granted, we know every child will not be the standards set by the Ministry of Education. So what happens? In Castries, there are 3 special education schools: Lady Gordon, Donato, and Educare. There are 3 others in the south. So there are places available and there are services available. We are an educational center. So we take children from, our hearing impaired children can come in at 3 years old because we need to do the early intervention. CDGC does it, but then especially a child who would require sign language, the best place to be is at the school. So they would interact with other children, but more importantly, interact with our hearing impaired deaf adults, because they have their own language and they can understand the children even better than even us who work with the children. So for our children who are coming through this CDGC, they already come with some kind of early intervention. So I would say to the parents, don't hesitate. I know it is hard. It is hard for you to accept a child with a disability, but staying away is not the best answer. And what we have found too, and I think that is one area where we are noticing the decline in numbers. Some children, of course, have hearing aids now and working better than what they had before. So they are now included in mainstream schools. So I have seen children walking with, 2 hearing aids or 1 hearing aid, and before they would be at the school because that was the only school in the north for children with any kind of hearing loss. But now they are included at the school, which is great because we are pushing towards inclusion, which is great. So I think that today is an opportunity for persons out there to hear what is happening and the reasons why, that we are celebrating World Hearing Day. Hearing health is important no matter how old, how young you are. And I speak to my students about it because they are, especially those who are hearing, thinking that it cannot happen to them, but it can. So I think today is an opportune time for us sitting here as a team, to say that we are working hand in hand. So Lady Gordon Opportunity Center is a wonderful place to be. Presently we have 94 students at the school. We have a number of our teachers are qualified, trained, specialized in special education as well. And of course, our main aim is to work with the child and to see how much we can do to give this child another opportunity to be as productive, as independent as they can be.
Thank you very much, Mrs. Prevail. Of course, that provides St. Lucian's parents the opportunity to know that there is an avenue, there's a place where children who have hearing loss can actually get to develop much better.
Yes.
Thank you.
Thank you.
Before we come to the close, I will just call on two persons to give closing remarks. We will get an opportunity later on. The ministry will provide opportunities later on where we can have further discussion as it relates to hearing health. First, I will call on Nurse Sydney to give some closing remarks and also encouraging persons when it comes to hearing loss, what can be done very quickly.
Okay. So again, thank you very much, and I'm very, very, very proud of our speakers so far, because even myself, I'm enlightened a bit more about some of the services that we have available. We would encourage everyone to come in to have their hearing checked. It is of paramount importance this year, as World Health Organization is launching, has launched some global standard for safe listening entertainment venues, they have launched two kits, the M-Safe Listening Handbook, which would target young persons, employees, and the persons in working in noisy areas. Also, they have also launched a media toolkit for journalists, and that would give them an opportunity at least to practice safe listening. So, as we heard before, hearing loss is on the rise, and it is something that we all must pay attention to, because we have heard how it affects every aspect of each other's life. So we are encouraging all listeners all around the world to practice safe listening. And when we talk about safe listening, we are talking about listening behavior that does not put any individual's hearing at risk. We are talking about, like Dr. Suraj said earlier, the risk of hearing loss depends on the level of noise, the loudness, the duration, and the frequency of the noise exposure. So we recommend that people listen to noise below 80 decibels, as he said, and maximum expected for the week is for 40 hours. So in order to keep below the 80 hours per week, it is important that people keep the level of the volume down as much as possible when listening to music, playing their games, and entertaining themselves. That they limit the amount of time spent in noisy activities, for instance, work, leisure, and at home. They monitor the safe listening levels over personal audio systems. And four, that they heed the warning signs of hearing loss, like Doc alluded earlier, tinnitus, this hearing, and also to monitor if the hearing is decreasing. So we are asking and we are pleading with the public to please access the free medical, free hearing healthcare services offered by the Ministry of Health, Wellness, and Elder Affairs at the various locations, as we said, in Viewfort, at the Viewfort Health Center, and at the Entrepot Wellness Center in the north. Thank you.
Thank you. And I will call on Dr. Suraj as a private physician and also an ENT specialist to give a quick message before we close.
Thank you very much. I would like to go back to base and look back at why we are here on occasion of World Hearing Day, 3rd March 2022. And the theme, as my pediatric colleague said, to hear for life, listen with care. Meaning that for you to have, you should be able to have perpetual hearing until you die. But this is not achieved because of the care we take when we listen. One example is urging me on, and that is when I see the young people with the earbuds, with the headphone, I don't know what loudness to which they expose. We need to do some research to find out when they are in their private listening mode, what exposure we have, because we don't know. And also, so I think research has to happen. And I think that we here, the four of us, are at the delivery end of service. We are not at the policy end. So I would like for us to use this annual event as a strategic planning exercise for us to come together and develop a united front to which to offer the service to the public, a service we have thought about, and we can charter the way forward with it. So I think that the opportunity now today is for us to develop a strategic alliance among all of us to be able to go forward and put hearing healthcare on a much better footing. Thanks.
Thank you very much.
Thank you very much. Well, with that, we've come to the end of our presentation on hearing health today. Of course, I want to thank the panel for being here and providing this valuable information to the public as it relates to hearing health, as it relates to children when it comes to hearing loss, and also the industrial sector as well. Thank you so very much for being here. Thank you.
Thank you.
Thank you very
Thanks
much.
for having us.
On behalf of the entire production team at Jazz NTN, I am Fennel Neptune. Thanks for watching.
Let me tell you, I learned